Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to share with you what I would consider some of my best advice when it comes to knee replacement surgery and the rehab and recovery afterwards. So these tidbits are really just big picture, overall general, you can call them mantras, you can call them, kind of words of wisdom, things that I kind of keep in the back of my mind and try to convey to my patients and my clients when it comes to the rehab and recovery process. And if you're able to kind of keep these mindsets and these thoughts in your mind and kind of focus on your rehab in these ways, I find that a lot of people who use these ways and use these phrases and quotes tend to have good outcomes, good recoveries from surgery, and can get through the recovery process effectively. So the first thing I want to say, the first quote or statement I have is, most people overestimate what they can accomplish in one day, but underestimate what they can accomplish in 1 year. And this quote has been attributed to different people, so I'm not even going to say who it's from because I'm not even sure the accuracy of it. But basically what it's saying is that, we get overwhelmed in the short term, in the short time periods of 1 day, and I have to do all these things. I have to get totally recovered. I have to build up all my strength. I have to build back all my range of motion and my bending and get rid of this stiffness and get rid of this pain and this swelling. And we try to do all these things in 1 day, but we tend to overestimate what we can accomplish in 1 day. When it comes to just that 1 day, we really need to keep it simple. Keep it maybe one main goal or maybe 3 at the most of main things that I'm going to do my exercises, I'm going to ice, I'm going to go for a walk, whatever that may be. We need to keep it simple and not overestimate what we can do in the short term in 1 day, or you can use any time frame, 1 week for example. But also let's not underestimate what we can do in the year. So what that means is don't underestimate what you can do in a long-term time frame. So for knee replacement surgery and the rehab and the recovery, don't underestimate the amount of improvements you can make in 4 weeks, in 1 month, in 3 months, in 6 months, in terms of strength, range of motion, managing your symptoms, your mobility, your ability to do the things that you want to do, to walk, to build, go to the gym and work out maybe, whatever that may be. Don't underestimate yourself. So in the short term, focus on what you can and don't overestimate and don't try to do way too many things all at once. But in the long term, don't underestimate yourself and understand that with time and in the long term, you can really make tremendous improvements and see tremendous changes. It's a marathon, not a sprint. I always say that. I'm sure there's many videos you can go back on where I say that statement. The next one I have here is focus on what is within your control. And this is a very, kind of a stoic statement, but it's extremely powerful. There's so many things going on. And if you think about your rehab and your recovery and you think about, oh my gosh, like all this pain, oh my gosh, this stiffness, this tightness, the weather outside, something's going on with your family or your friends that's you don't even want to worry about, or at work, focus on what you can control. So again, we're not gonna, we can't control what the pain levels or the swelling our body gives us sometimes, but we can focus on, I'm gonna do my exercises. I'm gonna do my, follow the advice and follow the instructions and guidance from my physical therapist and from my surgeon. And I'm going to follow up with everything. I'm going to be sure to ice and do the icing today. And then, I still might have this significant pain and discomfort, but I'm doing the right things. I'm doing the things that are within my control to hopefully manage that and start to reduce that and start to heal and recover and feel better. So focus on what is within your control, and don't focus on those things that are outside of your control. This one is a Winston Churchill quote, I believe. If you're going through hell, just keep going. And I say this in a very optimistic manner, in that, knee replacement, recovery, and rehab can be a lot. There's a lot of pain, a lot of stiffness, a lot of symptoms, a lot of difficulties, a lot of obstacles. But at the end of the day, for the vast majority of folks, unfortunately not for everyone, but for the vast majority of folks, it gets better. Your symptoms improve, your range of motion, your strength improves, your mobility improves, your ability to tolerate and to participate and do the things that you want to do is going to get better, it's going to improve. And for the majority of people, when it comes to saying, if you had the choice again, would you get a knee replacement surgery? The majority of people would say yes, they would. So if you're going through hell, just understand that it's kind of the nature of the beast. Stick it out. Just keep going. Just stay with it. Things will get better. There is a light at the end of the tunnel. Next one here is be a little better than you were yesterday. And there's part of a lot of different things to unpack from that very simple statement. And a lot of it is, one is we don't want to compare yourself to other people. It's good to have kind of the general benchmarks, the general idea of where you need to be in your recovery process, but there's going to be a ton of variability from one person to the next. So if your best friend or your cousin said that they were doing this by this time in their recovery, and seems like you're behind them, or seems like you don't have the same amount of range of motion, or seems like you still have swelling, just understand that there's going to be a ton of variability, a ton of difference. And it's better to just, focus on yourself, focus on being a little bit better each and every day, and that's all you can do. It goes back to, again, focusing on what is within your control and just being a little better, doing those exercises, maybe trying one more repetition or trying to push that bending a little bit further. That's good. Small steps, small progress is gonna be the best. And that's gonna lead me to my last point, is consistency is key. Being consistent is gonna be much more beneficial for you in the long term than a lot of different things. So it may be that you can push the intensity super, super hard during one of your physical therapy sessions or when doing your home exercises, but then you might cause a flare-up and you might have significant pain and symptoms, and you just don't want to do that. It's better to just be consistent, hammer away a little bit, chip away a little bit each day, and you're going to get better and better every day. Stay consistent, focus on what you can control, and just, stick with it, stick it out. So that's my best advice when it comes to knee replacement surgery. I know it's not focusing specifically on any specific physical therapy thing, but I think probably this video is as valuable, as if not more valuable than probably any video I've ever made on this on YouTube here. So I think if you found that helpful and found that beneficial, be sure to hit that like button so we can share this video with other viewers. Leave your comments, leave your questions, your thoughts below as I get back to everyone I see. I thank you very much for watching.